one of the concerns that I've had from the very beginning of this quarantine is that people were not going to be outside as much. Sure, there might be people outside walking their dog and getting some sun, but people are not going to be exercising as much in the sun. At least in San Diego here, the beaches are closed, right? You can't be outside walking around unless you're moving. You can't sit on a table at a coffee shop outside with your friends.
Let's go, Gavin Newsom. What are you doing?
I know. What are you doing, Gavin Newsom? I know you're listening to this podcast. And, you can't even be on the beach with your friends. And so I think that a lot less people are going to be outside. And because of the media, there was a little bit of a hysteria. There was a little bit of concern that, like, if I actually go outside, I could get coronavirus in the air, which is really pretty absurd that you're going to get coronavirus in an outdoor environment. The transmission of a virus in an indoor environment is much greater than in an outdoor environment. They closed all the hiking trails to suggest that people would have the same amount of sun exposure in the midst of a social distancing quarantine, shelter at home order is ludicrous. And so when this recent data came out showing that there's a pretty darn good correlation between low levels of vitamin D, and I'm going to share this data in a moment on the screen share, low levels of vitamin D are significantly correlated. Again, this is epidemiology, but it's all we have. Low levels of vitamin D are significantly correlated with a more severe course of COVID-19. I thought, of course, duh, like people with lower levels of vitamin D. And I want to get to the thing that you mentioned there, which is the nuance, because after this data came out, everyone said, we should be taking vitamin D pills for the immune system. And I did the smack my head, I did the SMH emoji, I was like, what? No, you should be out in the sun because, and I'll show you guys why.
You can also get some vitamin D through your diet, correct? Like through raw dairy and things like that, but it's maybe a little more difficult.
Pretty limited. The reason dairy has vitamin D is because it's fortified with it. So there's a small amount of vitamin D in cod liver, but I really think the majority of vitamin D we're going to get naturally is going to be from the sun. And the reason I think that's important is because so often when we're in the sun, we say, here I am getting my vitamin D. We never say, here I am getting my ultraviolet light, because we've been told that ultraviolet light is bad for us. But I want to share some data from a talk that I gave in the past, really highlighting that the vitamin is ultraviolet light. The vitamin, it's much beyond vitamin D.
Can you clear that up for us? Because I get confused about the different lights. Like, what's the light that's coming from the computer and coming from the phone? That's like a blue light?
Yeah, that's a blue light. So actually, I'll show all of that in a moment here. Let me share the screen here.
And blue light is, for most purposes, not good, right? Because it can lower your melatonin.
It's good. It's good in the morning. It's good during the day, but it's not so good at night. So I'll go through all that here in a moment. So this is probably the most significant paper I've seen. It's on the screen share for people who are listening. Vitamin D insufficiency is prevalent in severe COVID-19. I believe it was published on April 29th or thereabouts, just in the last few days. And for people that are watching, they defined vitamin D insufficiency as less than, I believe, 30 nanograms per deciliter. I want to get that. Yep, 30 nanograms per milliliter. So vitamin D insufficiency was defined as a serum 25-hydroxy vitamin D as less than 30 nanograms per ml. And what they found, the results were that among ICU subjects, so among patients in the ICU, 84.6 in this study, it was a small study, 84.6 had a vitamin D insufficiency versus 4 on the floor. So 84.6 in the ICU had vitamin D deficiency versus 57% of those on the floor. Wow. They said strikingly, 100% of ICU patients less than 75 years old had vitamin D insufficiency. Among these, 64.6 had critically low 25-hydroxy vitamin D, less than 20 nanograms per ml, and 3 had less than 10 nanograms per ml. They said they can calculate other scores, something called a sepsis-induced coagulopathy score, and they mention how many people in the ICU had these elevated sepsis scores. It's kind of a objective, or it's a calculable metric for how severe it was. They say suppressed immune function was prevalent. 92.3% had low lymphocytes, which is a type of white blood cell, and 9 were profoundly lymphocytopenic, which means very low lymphocytes. in the ICU of the people with vitamin D insufficiency. So very striking study. Again, small study, but pretty striking data to begin to correlate some of these concerns about vitamin D with coronavirus.